We're back and we're going to resume our routes. In Route 1, we're going to talk about the Sustainable Development Goals in practice using PPPs. Tavianin, Head of Cooperation of the European Union. In Route 2, we have the panel Model of Private Participation in Healthcare Infrastructure, and the moderator is going to be Cristina Simón, and she works with healthcare and investment in IDB care. In the next panel, we have mobilization of infrastructures, and the moderator is going to be Joseph Henrique, Head of Resource Mobilization at BID Invest. Wonderful panel to you all.
Thank you very much. Good day to all. We know that Latin America and the Caribbean has been affected strongly, more than in other places in the world. As a matter of fact, 1/3 of the deaths were in Latin America and the Caribbean due to COVID. As a matter of fact, the population is just 8% of the whole world population. In this context, we know that the health sector is the sector that has suffered the most because of COVID. Quality is low, and there are many people who die due to low quality of health service other than access. Well, for both public and private sectors, it is important to get united to face the challenges of this time. Thanks to the scientific community in alliance with the private sector and also with the acquisition of a public sectors, we know most of the countries know that we have enough vaccination for us to face this pandemic. We know that, nevertheless, there is a big gap in terms of investment in health service of more than $50 million. This is just with regards to needs, basic needs, and equipment and modernization of the infrastructure that exists today. There are many opportunities to improve the efficiency of our investments, and our private sector has a very important role to approach these problems. PPP can do, of course, and make things more affordable and also profitable in their infrastructure. So there are some countries that have proved that right. Historically, we know that there are presences of PPP in health, and there is a growing interest in this kind of infrastructure. I would like to invite to make comments about this thing. We have four panelists. Ricardo Tardelli, he is a representative of the government of the state of São Paulo. He is in the health secretary. María Susana Morales, she is the project portfolio director for the promotion agency of private investment in Peru, PROINVERSIÓN. And also, Rolf Hoenger of the head area from Latin America and of Roche Pharma, and Ramiro Zinder of the state of Santa Catarina in Brazil. He is the executive secretary of partnership, public and private partnership. First question is to Ricardo, and of course to he is a government representative. I would like to know from your opinion what the major challenges are when you have a PPP in the sector of health, and how you faced the challenges, in your case, in the state of São Paulo.
Good afternoon. First of all, I would like to thank you for the opportunity and the invitation. I would also like to greet our colleagues in this panel, and especially Cristina Simón, representative of the IDB. Here in São Paulo, we are about to conclude a project with IDB funding. It's called Healthcare in Action Program, and it enables us to fund 60% of the capex for for 2 of the 3 PPP hospitals. It is a huge pleasure to be here along with the bank. I would also like to greet Rolf, Ramiro, and Susana Morales. It's a pleasure to be discussing with you. In the city of São Paulo, we have 2 hospitals that are working with the PPP format. So the private area. We also have the healthcare services which is organized by a social organization. We have a hospital in Sorocaba, another one in São José dos Campos, and there's another one whose construction will be concluded in 6 months. It is a hospital for women, an oncology hospital for women. We're all very enthusiastic because the hospital is really encouraging. The quality of the construction is excellent. Technology is also the best Brazilian hospitals and worldwide as well. The quality of the infrastructure is also impeccable. The hospital calls attention because of the automation, which was an option. The hospital is extensively automated, and for you to have an idea, in each and every one of the hospitals we have about 4,000 sensors that are connected to the internet, and they monitor all of the indicators so that we are aware of the KPIs development. The hospitals are really different. People usually ask us what are the needs for us to be able to do something like that. Well, basically, we have 3 important aspects to be discussed.
The first one is the fiscal aspect of the agency contracting. PPP contracts are long, they're 20 years in general, and they must have considerable fiscal responsibility. The second point is knowing what the actual needs are and what to expect from that institution. So good project modeling is key. We need to know what the demands to be met are. We need to benchmark in order to find out which best practices are being adopted across the country and internationally. And we also must be familiar with legal and financial modeling. And the third point is the institutional strength of the contracting agency, so that the private investor can feel safe when making an investment in such a long-term contract. That requires institutional certainty, so solid guarantees and a government with the right legal framework and willing to enter into a stable partnership. Stability is the name of the game in order to attract the private sector to the business. Those are the basic assumptions to start with.
Thank you very much, Maria. Susana, what is your experience in Peru and what are the major challenges that you had? Is there any example that you would like to tell us? Let us know, please. Well, as a matter of fact, I would like to first thank you guys for the invitation to be part of PPP Americas. And it is a great chance for us to be able to share our experience in Peru and also you all panelists, my friends. Thank you. I would like to approach the issue like this. There are a lot of opposition to PPP projects in the country. They say that we are privatizing our health system. But this is a very dubious position because there is some sort of prejudice. PPP are too expensive, they think. And also, there is the fiscal issue. So there's a lot of things related to methodology, to assess. Well, this is the first opposing force that we have to deal with. And also, as I said, because we are privatizing the health system. So these are the things that we have found when we try to develop PPP in the health system. How we have to deal with this? Well, we try to provide as much information as possible to the public. So knowledge. Knowledge is basically the answer. We try to explain that APPs can bring benefits, not only during the construction and the establishment of the project, but also and mainly operation and maintenance. In the last few years, there were other mechanisms of contracting services for the development of public projects. Yeah, you're going to have a construction, but then after 30 years, you have to maintain it. And we say, if you really believe that it is a challenge to build a hospital, let alone how hard it is to maintain the hospital. This is the excuse, this is the explanation we try to give to the different sectors of our society. I can give you more details later. Anyhow, in the case of Peru, we today have some hospitals that are already operating. And there are some hospitals like with this white scrub and hospitals and green scrub hospitals. And of course, these are state or semi-state or semi-public entity, these entities. And of course, there are figures that grant us a good ground. So we can compare service provided when you have an APP or when you have a public hospital, so publicly managed hospital. We can compare based on the figures that we already have. I don't want to just give you too many details with regards to figures, but what, for example, PPP hospital, the doctor income, so the physician would make kind of not income, forgive me, it's like 5 visits per hour, and in the case of the public is 3 people seen per hour. So basically, you can see that there's more attention provided. So with regards to consultation, external consultation, 85% of external consultation is in attention, and you have an increase on the surgical procedures and medicines managed or distributed also more. So in the public hospitals do not reach those levels. And some of the institutions, maintenance, operation and maintenance is different. So we actually ran studies to detect how much less expensive it is in the maintenance. And of course, we have best results. We compare because we have, for example, Children's Hospital, and we have one that is public and the other one is PPP. Well, of course, both are public, but one is PPP. The management is PPP. And $1.5 million and the PPP is less expensive. It's like $1.5 million less expensive compared to just the solely public institution. Anyhow, there are advantages. And with regards to the risk, in that the risk is that it is more expensive, or because not only for the construction, but also the long term. Then we have to consider the long term. This is very important. Another risk that is with regards to hours, 50 hours sample, and only 17 that were really operating. So basically, there are so many details that show that it is so much better to have a PPP institution. That is, of course, they say that the PPP is more expensive, but as a matter of fact, we say that is. Of course, there is this discussion that they are privatizing the health system in the country, but with regards to the gray or the green scrub hospitals, we still try to explain that everything is doctors and nurses will still be under the state umbrella, and this is a form of explaining our project portfolio. Many other decisions made, and there are so many meetings at several different levels, from ministers to local authorities and regional authorities, and also, most importantly, the users, who are our allies. They are the ones who are going to receive the service. Thank you very much. Very interesting that in the end, the opposing public, this is a challenge to all of us and many of the stakeholders. You know how you deal with that? It's transparency and information. This is how things should be done. Now, as Ricardo mentioned, with regards to the fiscal challenge and financing aspect of that kind of project, I would like to hear from Ramiro what the main challenges that we have in the case of establishing PPP hospital institutions. What are your experiences? Tell us about your challenges, please.
Good afternoon, Cristina, other panelists, and all those attending PPP Americas. Thank you for the invitation to take part in this event. I'd like to thank the IDB for supporting the Santa Catarina state in structuring the PPP project of the Santa Catarina Hospital Complex, a complex that includes 4 hospital units, 2 general hospitals, 1 children's hospital, and a maternity ward covering 83,000 kilometers. And we are implementing the project through a partnership with the IDB. I think the main challenge, not only for health projects, but for PPPs in general, but more specifically in healthcare, due to the amount of resources involved, is an ability to guarantee these projects. That's a challenge in Brazil when it comes to such projects. And in government structures, especially the state agency for finance, agencies that are responsible for government funds, it's very hard to consider a project to build facilities that may never be concluded and that have a hard time raising private funds. But in Santa Catarina, we've been working hard to that end. We have passed a law to create a guarantee fund for PPPs in the state, and it plays a key part in a guarantee system that we are creating here, which I will explain to you later. But before I go into that, I always talk about payments in general here in the state of Santa Catarina. Our idea is that we are creating this guarantee fund, but we hope not to have to use it, because we believe the state should make good payments, and hopefully one day our PPPs won't require any guarantees. We will just believe that the state will be able to make payments. So the payment flow that we are creating here already includes a great deal of certainty, because the state agency for healthcare here at the hospital will have a specific budget for the payment of the concessionaire. So there are already funds specifically for that purpose, which provides certainty that these payments will be made regularly. Nevertheless, these payments will be monitored within the state agencies for finance control system. Not all states have that control system, but in this case, we've done it because we want to set the right example. So these payments will be controlled by the state agency for finance, and any delays will be identified immediately so that it can be stopped or corrected. And if that doesn't work, then we have the guarantee system. We have a law that has been passed, and the guarantee fund plays a key role in case of default. The fund will guarantee the payment of the concessionaire. Funds come from the Treasury, from concession fees, as well as other destatization funds in the state. So that fund will be used if there's any default, and if the required funds to pay for the guarantee aren't enough, then the law that has already been passed sets forth that some revenue that comes from a participatory fund will also act as collateral. So we have two collateral layers. One is a guarantee fund, and the other one is linked to revenue. So if the fund doesn't have the resources required, then the associated revenue will send funds from the Treasury to the fund to pay the concessionaire. So that's the system we have set up to provide certainty to our hospital complex PPP. Just to conclude on the challenges, in addition to fiscal challenges and the guarantees, these projects, we heard from Maria Susana that we need to convey the right kind of information to society about this kind of project. And as important as communicating information to society is internal communication, communication within government structures, because these structures are very broad. Everyone is worried about their own communication. Everyone needs to be aware of what is being done. Everyone needs to be on the same page, so that within the government, we all know what we're doing. If we know what we're doing within the government, then our communication to society will also be better.
Thank you very much. I totally agree with you with regards to the reality. There are some occasions in which, as a matter of fact, you have to consider that there must be a total connection with this kind of contract, and we have to know what it is to have ahead of us. Well, I would like to mention what you just mentioned with regards to several types of rules and norms and regulations. Of course, this is one of the other challenges for our PPP, and that happens in other countries. So the exclusion of health or hospital infrastructure that are excluded, or other areas within the health sector. With regards to medicines, of course, we have several innovative PPP associations, and with regards to use of medicine, there could be a lot of benefit in a sector. Now, I would like to ask then to how you believe you should standardize the activity and to stimulate trade in the reality of pharmaceutical problems. Just thinking about the PPPs and in the pharmaceutical sector, so perhaps you could just give some light about it. Thank you very much, Cristina. Of course, we, once again, as just like my friend said, I would like to thank you for the invitation. And yes, I would like to share our views. With regards to what you just mentioned, in terms of the advancements of technology and science, there was a lot of change in the last few years. Yes, we know that. It is, of course, for the improvement and the quality of health that we provided. So we have better diagnosis thanks to this improvement that we had. And we all know that Latin America, there's still a lot of room to do that. There are so many patients that do not have access to treatment or to health system. To improve this, with effective and quality services. We need, of course, medicine and we need technology. But essential basis of a public health system is to count on fundamental aspects for universalization of health in our countries. So regional entities or national entities or regulatory agencies have an important and fundamental role for the development of the health sector in the country. They are responsible to establish safety, efficiency, and the good use of technology. There are those regulatory systems, yes, they could be very complex and they need a lot of human resources, highly qualified human resources. These processes are too long. What does that mean? It means that there are many barriers for an innovation to happen, and then to bring innovation to the users is also very slow. So, and it also there's a lot of red tape between regulators and users, and the framework that exists is it makes everything too complicated. Our work is actually to facilitate the flow of innovations, and we have to consider all those studies, clinical studies, and trials that can be done in a country, and of course, make the best of the technology that exists in the country. In that sense, we've been trying to improve those regulatory processes, standardize the processes so that uh, we all speak the same language, that we have the same kind of setup between one country and the other, to prevent us from having so many barriers that already exist. This is what we are looking for, to create alliances, to have the possibility, for example, of accepting a regulatory decision that has better or same or better standards. So in this sense, we can communicate in a better way. It is a whole collaboration process, not only a formal PPP establishment. And it is a process that can be transparent and can be managed based on the trust, mutual trust among all partners between private and public sectors. Thank you. As a matter of fact, you spoke well. With regards to innovation, yes, this is a sector that is changing so much, principally in the last few years. No, actually, the last year with the pandemic. We have seen so many countries issuing norms and of course allowing telemedicine. You know that, Ricardo, we know that you have several different types of health institutions. So what is the most innovative and most efficient in your opinion? So of course we spoke about some of your cases, like the success examples, but now from you directly to the public, what kind of innovations we can expect to have in the near future with regards to the PPP position and health system in São Paulo, perhaps in other states too?
I'd like to talk about this transition from a state-based model that Maria Susana mentioned and Ramiro mentioned, which this transition from the state implementing things to the state managing things. That's a challenge, and it may be the answer to your question, Cristina. How we, public officials, should be qualified to deal with these new challenges, because PPP contracts are complex and we need to be ready to manage them as well as we can.
The technologies and institutionality would enable us to work along with legal areas, financial areas, so that we can better use our resources. So it's important to support the different activities, but the main challenge has to do with that. And another thing that occurs to me is that the state could offer clear rules for regulating agencies to provide comfort to the management of the business as a whole. To this day, we weren't as concerned with the effective costs because public hospitals have their own budget. They do everything as possible. But when we start working like that, we have to take into account how much a day in the ICU will cost, how much a surgery costs, and how can we set standards so that we know that what we're doing is adequate and complies with the requirements of the market. So all of these internal advancements in public management are also very important. And of course, we know that the market tends to work with telemedicine or the technological innovations. And that is very attractive, not only to work with hospitals, but with primary care, where we will have improvements in chronic diseases, which prevail in our environment. But I also wanted to talk a little bit about this. It's important that we improve our ability to manage. We still need to better qualify, learn how to buy services, manage them, and also manage contracts. This provides stability. Stability is an important word. We need to have stability. We need to feel that we're working in an area where things are done according to established criteria and that we're comfortable either way.
Thank you very much, Ricardo. What about what we can expect from the pharmaceutical industries? Well, with regards to technology, medicine, so what we're expecting is that what it is related to the personalized, customized medicine. Today we have much more insight. There is a big concern, which is along with all that, we can have more innovations. We also should think in sustainability and efficiency of the health system. This is basically part of our concerns. Of course, in a forum of discussions like this one here, what we're talking here is about public-private collaboration. This, we are co-founders with the Copenhagen Institute of Studies, and we want to improve the public health. What is this 2030 health movement? This is an initiative. It's more like a collaborative platform. Everybody who really wants to improve the health system can participate, can join effort. In this sense, what we want to do is to identify what are the major problems, with all so many changes that we have in the next 10 years in the health system. Of course, there's so many new diseases and there's so much more information that there are problems with accidents and infectious diseases. There are different things that are so new to all of us, and of course we have the chance now to establish a good question mark and ask ourselves, what should we do to face those challenges? We need to count on sustainable institutions. We have to give examples. In Chile, for example, there is a lot of wait for you to be diagnosed, to be treated in the system. Why? Because there's no visibility where there is capability. Principally, it is a very unstable system. We're trying to find a solution along with the government. In Peru, we have problems related to the budgetary problem. That is a chronic problem in that country. So, along with the Cusco region, we are trying to build something. We can show that there is a possibility of improving forms of putting things to practice, improve the efficiency. Well, why do I give you these two examples? It is because we have to, uh, in a short term, work with new ideas, and we have to work out details along with the state to change the structure. And I think these are two cases that are very relevant. Well, thank you very much. With just a little token that you give us, so we wished we would have more time to get more information. Maria Susana, you mentioned Peru, right? What other PPP in the health sector they're going to have in Peru? Well, let me see. We have 5 health projects, a little different from what we heard now. We are now in a stage in which we are calling people in to participate with their comments. And there are 2 regions in the north of Lima, it was actually the north of the country, and there are 2 highly complex institutions, and they are green scrub institutions. They're going to provide services uh, such as hemodialysis and lab services to the population. So you're gonna have to. Otherwise, if they don't get those exams or those tests there, they would have to drive, or they would have to travel for 300 or 400 kilometers, or like 5, 6 hours, and we are just making headway. So we are bringing a better service to the population. So what happens is like we are still in the transaction stage, and the other one it is basically a little different. The other project is related to the solid waste management of 387 establishments of health in Lima, with a capex that is not too large. It's 40 million approximately of capex, but this is where basically related to the intra-hospital solid residue management. So this project really contemplates several aspects of the management of hospital waste and the transportation of the waste, and also the whole thing related to there's a plant for the treatment of those residues. So it's a very innovative project, and in a couple of years we're going to have expecting at least to have in 2022 to be able to bring it out to the market. This is one of those projects that give us a lot of hope because it is totally different of what we've done so far. Yes, thank you. Actually, the integration of services is one of the best approaches, ideas to make this health sector sustainable. It is innovation that is unexpected by all of us, unexpected by all of us. In your case, Ramiro, due to the short period of time that we still have, but would like to ask you with the last question. What kind of novelties that you're bringing with the PPP hospital that it is being established in Santa Catarina?
What we're going through today with the pandemic of COVID-19, and everything that we're still going through, things that we went through last year and things that are going on this year, is the need for quick responses in healthcare. This is the main lesson that we have from all of this experience. So the whole planning, contract innovation of this PPP project, all of the changes have been conceived so that we can provide faster responses to guarantee health care for our population. This is the lesson that is here to stay, and this is what we're considering for this project to be successful.
Thank you. I would like to thank you all, Ricardo, Ramiro, María, Susana, Rolf, I would like to thank you for your participation. It's not much time for us, but I would like to say that hopefully this PPP combination will be part of the solution, and hopefully that health sector has proved to be one of the best for us to move out of this pandemic moment. And of course, the private sector has to be involved in helping the public sector and as another fundamental to achieve these results. Thank you very much and have a great day. Thank you for your attention.